Welcome to the Professional Patient Podcast. I'm your host, Michael A. Weiss, and this is part 2 in an episode that's called How to Use Technology and Social Media for Your Health. In part 1 of the episode, I mentioned that I had put together 3 lists because I thought that was the best way to analyze this. The first list, which we went through, was the list of technology tools available to patients. List number 2 was the queries that patients ask when they try to use technology for their health. List 3 are the social media tools. So this particular episode is all about those social media tools, and I'm going to go through that list. But before I do, just a couple of comments, because since I recorded that episode, which I'm going to introduce in a second, something very important happened in the business world and I think in the world of healthcare social media. The company Google terminated or abandoned their social media healthcare initiative called Google Health. Now, as I explained later on in the list, Google Health seemed to be a fantastic tool, but I think it was a little bit before its time. And the reason why, I guess it failed, I hate to call anything that Google does as a failure, because I'm sure that they're going to come back, but the reason why it didn't work was because of electronic medical records, EMRs, or they would call them, I think, personal health records. There's no standard. Different hospitals and different doctors want to use different digital standards. And there's also the problem of different hospitals and physicians adopting or accepting Google Health. So what do we learn from Google Health? I think we learned that healthcare social media, at least at this point in time, is definitely going to be a patient-driven medium. And its success and its potential is dependent upon how many patients interact and how much information they interact with. And I've had interactions using technology and social media with medical professionals like doctors and nurses who are incredibly kind, smart, and compassionate. But they're participating in social media almost at their peril because they really can't do much. Yeah, they can give a lot of general information, which is very helpful and much appreciated. But they have to worry about regulatory issues, licensure, even legal issues. And the people who define these regulations and rules are these governing bodies who have the greatest of intentions. But can they really keep up with the speed of social media? I think it's going to be tough. I mean, I want medical professionals to keep participating, but I think patients need to understand that healthcare social media is only going to go as far as we take it. The only constraint patients have is privacy. You know, what is private to one person isn't private to another. So it's each patient's respective privacy concerns that will limit how much patients participate in healthcare social media. And I think in that lies the power of healthcare social media and the progress of healthcare social media. My third comment about social media, and really it's the best way I know how to explain it, is I think it's analogous to the jam-based band The Grateful Dead. Now, people out there may not know who the Grateful Dead are, or who they were, or they're known by another name further now. But for years, they encouraged their fans to tape their concerts and then share the tapes of the concerts. And obviously, this is not a good business model to sell records. But they created a phenomenon, and fans of the Grateful Dead became a community. They were basically exercising social media, but without technology. And it was powerful. And they became, and still are, one of the top grossing bands in the world when they tour. Now spin it to healthcare social media. I think patients have that same power. If patients share information and experiences with other patients and form these loyal patient communities, I think what we're going to be creating is almost like an instantaneous database of knowledge and experience. And who's going to benefit from that? Other patients. And then in turn, these patients will use healthcare much more efficiently. And from that, I think doctors and nurses and hospitals will benefit. And then together, patients and medical professionals will get back some leverage that they lost to the healthcare insurance companies. So healthcare social media has a very important place in the development of healthcare. I really wish medical professionals would stop worrying about what they need to do and what's the best way to maximize social media. I mean, I applaud their interest and I appreciate that they want to get better, but it's let it develop on its own. I think patients will develop something that will become extremely useful for medical professionals. Then we can go from there. But that's what I think is going to happen. Again, I look at the Grateful Dead, I see what happened with that. That was social media, but without technology. Now we have technology, so it's going to happen even faster.